Hello, everyone. This is Cole with the American Journal of Healthcare Strategy, joined by a great guest from Virginia, Hannah Hawthorne. Hannah, please introduce yourself and your current role.
Hi, Cole. Thank you for having me. I'm really excited to be here today. I'm Hannah Hawthorne. I'm originally from Salt Lake City, but relocated to Virginia to be an administrative fellow at UVA Health University Medical Center. And I'm about 14 months in, so our fellowship is 2 years long, and so that part in. But I have been in healthcare for a little over 10 years. I started actually my senior year of high school working as a pharmacy technician. Um, I worked that all through undergrad and left healthcare for a little bit, but during 2020, during the pandemic, healthcare brought me back in and learned about a little bit more about healthcare administration during that time when I helped with the COVID vaccine rollout process at the hospital I was working for. And then just really fell in love with bettering best practices in healthcare and driving broader initiatives. And so looked into healthcare administration, looked into administrative fellowship, and haven't looked back.
Thank you so much for coming on and giving us the great introduction there. I think that's excellent. You've had some great experiences, and of course, Utah. That's a long way away, right? Coming from Utah to the East Coast. How are you adjusting to the East Coast?
Ooh, well, the storm right now has been new because we don't get tropical storms in the desert of Salt Lake City. But it's better than a blizzard, so I will take it. But I really love how centralized everything is on the East Coast, like 6 hours away from New York, like a 12-hour drive from Florida. And so I really enjoyed like how close all the states are here, and really enjoyed getting to know uh, different groups of people. I think Utah's a little more inland, so um, less people from all over the world. But Virginia has a lot of diversity, and have really enjoyed getting to know people who are from places that I just barely learned about. So it's been great.
Of course, and we're happy to have you on the East Coast here with with us. So you have this great kind of resume here. There's some really interesting things I wanted to talk about. I think the first was just looking at it here, was this bachelor's degree, and what I'm looking at is in English language, literature, and then Japanese studies. I mean, this is an interesting series of majors. What caused you to get these majors, and what was your kind of end goal in mind when you started off with undergrad?
Yeah, so I come from a family of educators. So when I first went to undergrad, I was working in healthcare because I needed a job to work through undergrad, but I thought I would become an English teacher. And so that's what I set out to do. And I was 18 and starting in college, and uh, did that for 2 years, and took a 2 year break from school, and I did a volunteer mission in Japan and just fell in love with Japanese culture, with the people, and with the language. And so I knew that was something I wanted to continue to study, and thought that I would find a place in international relations following graduating from undergrad. But I think COVID put a lot of things in perspective for me on what I wanted to do and what impact I wanted to make in the world. And I think educators, my mom's one, my grandma's one, make such an impact on young minds and on shaping the future generations. But I really wanted to have a more active part in shaping the health of our nation and the health of the people around me. And so I decided to get back into healthcare, and it's been a great journey.
And so that mission is so cool. Being able to go out of the country to do that, that is awesome. Did you gain a lot of insight into how other people live through that experience?
Yeah, so I think the biggest thing for me, grew up in a more rural state in Salt Lake, in Utah, in Salt Lake City, and while we had like public transportation, um, it's not what it is in Japan. And so just learning to like live on a bike instead of a car, how to ride trains, like those were some different cultural things for me. Eating with chopsticks. I when I first moved to Japan, I was always so offended when someone would bring me a spoon because I would like be eating with my chopsticks and they would like observe me and then at a restaurant and they would bring me a spoon. But slowly I got really good at chopsticks and so no one brings me a spoon anymore. And so one of my humble brags is that I learned chopsticks. Such a unique language, very difficult but so beautiful. I really wish I knew more than I do, but I actually went back when I was an undergrad and studied abroad there for a semester, and studied the writing and reading there. And so really just fell in love with it from my mission trip. And then so much that I went back and learned even more. So it was a tremendous experience. And I would just say everyone says this about Japan that the people there are so polite and it's really clean there. But it just taught me a lot about stewardship and how to be a good steward of your resources in your community and the kind of citizen I want to show up being. Like, do I want to be the citizen that picks up trash that I see on the street? Do I want to be the person that takes time out of their day to help a stranger and walk them to the next place? I know when I was, especially when I first was learning how to read Japanese, I would be so lost in train stations and people would come up to me and be like, "Can I walk you there? Like, where are you looking to go?" And so that really just shaped how I approach people who are in, here trying to navigate the space, whether they're in America in a new place or just moving here. That really changed how I approach there. But I actually, when I studied abroad, had a unique experience of going to the doctor's office when I was a student. I got like just like a very severe virus and ended up going in. Um, and it was really difficult to navigate the healthcare system in a language that I was learning. And it put a lot of things in perspective for me on I how our healthcare system can be better for people who are also English language learning.
That is such a cool experience. I mean, not, getting sick in a foreign country, but in a way, what a beneficial experience, right? Because, we're dealing with, especially in the East Coast, like you mentioned, huge amounts of immigration from all over the world, from different sections. They're coming in different ways. And so, how can we assist them? How can we help people who are not as familiar with the country as we are, having lived here, with the language, having lived here? Even for us, the health system is confusing. So just imagining how it is for people who are, just immigrating to the country. And so that's really an incredible experience, very important. Thank you for sharing that. That's very awesome. And so coming from that, of course, after your undergrad, you decided to get your MHA, but it looks like for a while, looking at the resume, you were, doing pharmacy technician for looks like a very long time. And then you also taught some pharmacy classes as well as an adjunct professor, which is a unique experience. How did you get involved with kind of being a pharmacy tech? Were you looking at potentially going to pharmacy school eventually? Just tell me a bit about that.
Yeah, so I started as a pharmacy technician. I took the certification course during my senior year of high school, and um, it's kind of silly how I got started. But I had just a friend of mine. She was a senior when I was a junior, and she had done that. And she was like, "Pharmacy, they work really good hours, so it's great for you, and they make really good money. So you can make great pay while you're still an undergrad, and you can pick your hours." And so she was a great mentor to me and just actually a great example on how it's important to find mentors and grasp onto them in all stages of your life. But so she recommended it, and so registered for it. One thing about me is I am very squeamish, like around body fluids. So that's pharmacy tech was as clinical as it could get for me. Um, and I did initially, so I really love being a pharmacy technician, and I like think people joke like, "Oh, you just count pills," but there's so much more of that. You're the liaison to between the pharmacist and the physician. A lot of times, you're the person that the patient talks to first when they're navigating either a new medication or a scary insurance situation where they don't know. I mean, we all know drug prices are very inflated in this country, so helping someone navigate their insurance, or speaking. I think we alluded to it, but the language of healthcare in this country is very, very complicated and difficult to navigate. And not everyone goes to the doctor a lot. Not everyone will be at the hospital, but most people will go to the pharmacy at least, 3 or 4 times a year. So really being that front facing representative of the healthcare community was something I really loved. But I did not want to be a pharmacist, and I knew that pretty early on. I think days are very similar, and I love a lot of variety in the day. So I knew that while I loved being a pharmacy technician, I wanted to explore other career fields. And so that's how I got started in pharmacy. But it definitely is what sparked my passion and my love for healthcare. Um, and then how I became a professor was actually just a little funny. I was on LinkedIn, pharmacy technician, and getting my MHA. And I think like all those things were on my LinkedIn. And someone just had reached out to me. It was like, "Hey, I'm hiring for this job. It looks like you'd be a good fit. It looks like you are wanting to get more leadership and lecturing experience based on your resume. Would you consider applying?" And so I applied. I interviewed. I was 24, so I was pretty young at the time, pretty nervous to do it. But it was such a good experience to work with like to really grow that passion for people in healthcare, for a field that I loved working in, and for people who, a lot of times are like fresh out of high school, wanting to just kind of figure themselves out. So it was a great dual role of getting to share my passion for healthcare and for pharmacy, but also help shape young minds and their love for healthcare.
And that goes back, of course, to your family, like being educators, right? Like you guys, have that kind of tradition, that family tradition of teaching people too. So that's super neat.
I did not accidentally end up in academic medicine. Like it was very intentional that this is why I'm here.
I mean, good to know too, because it seems like that has been definitely something on your path, right? I mean, you've, you know, working for University of Utah Health, going to University of Utah, that's a big school. And then of course, UVA is an awesome academic medical. And that's something we should talk about as well is you went through your MHA program and then you decided to do a fellowship. What was that decision, right? How did you come across fellowships? Why did you decide to do a fellowship?
Yeah, so I worked on the COVID-19 vaccine rollout at the University of Utah, and that was actually a fellow project. So one of the fellows at the University of Utah, he was leading that initiative, and met him there and was introduced to what administrative fellows were. And kind of at that same time, thinking that I wanted to stay in healthcare, it was kind of a crossroads for me because um, I couldn't do student teaching because of the pandemic. And so I was thinking, like, do I want to stay in healthcare or do I want to get my master's in education and do student teaching after I get my master's? But just seeing like the impact of a non-clinical worker, and how they can help enhance community health, public health, and the lives of clinical workers, it made me think like, okay, that job's really cool. I would really like to be able to um, stay in healthcare, but maybe not do those clinical things that I'm personally squeamish about. And so that's kind of how I got into healthcare administration was um, just staying in. Sorry, I'm misspeaking. So that's how I got introduced to healthcare administration and doing an MHA. And then a fellowship particular was because I knew fellows worked on high level projects and directly with senior leaders. I wanted that exposure. And so when I started my MHA, I knew pretty immediately that I wanted to do a fellowship. And so my program, the University of Utah, I very much bleed red, if you can't tell from my resume. Went to undergrad there, worked there for a few years, and then also did grad school there. So love the University of Utah. But at the University of Utah, one of the amazing pieces of their MHA program is they offer a lot of fellowship counseling. So they have a fellowship prep course, which goes during the summer, and it's not free because you pay a lot of tuition, but it's not extra tuition to participate in. Um, they offer interview coaching for pretty much like any role, but it's very much tailored to fellowships. Um, and so knew early on that that was something I wanted to do and got a lot of direction and coaching, hands-on direction and coaching pretty early on in the interview and in the application process. But I knew I wanted the exposure to senior leaders. I knew I wanted to work on high level projects. And I knew that while I had worked in healthcare for a long time, there was a lot of things that I could benefit learning more about. And fellowship is that very safe space to learn and to get real life experience, but also have the security of, people understand that you're a learner, this is your first time. And the risk is of course high anytime you're in healthcare because it impacts people and patients lives, but at the same time it's not as high as stakes as if I directly went into like a management role or a different role. So grateful I did the fellowship route. And I also really wanted to bolster the amount of mentors that I had. And even though I love the University of Utah so much, I knew I wanted to get exposure to other organizations and how they provide healthcare and how they're bettering the health of our nation. Because I learned from an amazing organization. The University of Utah is doing amazing things, but just to come to the University of Virginia and see equally amazing things being done here, and a different dynamic, right? Came from a more urban, um, that academic medical center that has a lot of rural encompassing areas, in the Intermountain West, and then to come to Central Virginia, where we predominantly serve the rural population, but are still delivering high quality care in an amazing way. So, love the transition, and I'm very grateful and blessed to be here.
Oh, that is great. That is really awesome. I'm so glad that you've had such a great time there. I'm a big fan of UVA as well. I have some good people I've spoken with over there. And I think my intern, actually, one of my interns, or well, he's now an operations manager. He just interviewed for the fellowship there. I think he had met you.
Yes, yes,
Yeah, so
he's
it's a
great.
great institution. He was really excited, and so it clearly draws in a lot of incredible talent. And so I want to ask, how many fellowships did you apply to?
I applied to 2 years ago. I applied to 6 fellowships. If I Yes, I applied to 6, and I predominantly looked at academic medical centers. I also have wanted to be an educator, um, a special love for children's health, and so wanted. I applied to a few children's hospitals as well, or hospitals that have a strong children's hospital. So that's kind of where my passions were. We're either working with children, and trying to shape the health of the population early. Especially one thing I love about children's health is, of course, you're caring for the child, but you're caring for the full family. So there's a lot of population health aspects there. And then academic medicine, of course, like love clinical research, education oriented healthcare. So, and of course, um, a former educator and hopefully future educator, I really gravitated towards academic medicine. And UVA really was the best of both worlds. We have the number one children's hospital in Virginia. So very proud to be here, and proud of the team that really has made that happen. I think it's no secret that a lot of work goes into that, and we have, it's just such a pleasure to provide such quality care to our patients, especially our youngest, and most vulnerable patients. And then, of course, within our children's hospital, we have it's a hospital within the hospital of an academic medical center. So UVA was really the best of both worlds for me, and I'm very lucky to be here.
What are some of the coolest kind of projects or things that you've worked on while being at UVA?
Oh, yeah. So I've gotten to do so many amazing projects. And I think one thing that I love about this fellowship in particular is your first year, you are entrusted with these very big projects. And Wendy and Abdi Somo, he's the chief administrative officer, and also is a big mentor within the fellowship program. They curate these projects to help grow the skills that you lack. And so one of those projects is I got to help open the first Parkinson's disease clinic at in Virginia, actually. So in all of Virginia, the first um, clinic, comprehensive clinic for patients with Parkinson's disease. And so that was amazing to get to work alongside the clinical team. Dr. Shaw, I can't say enough good things about him. He's so passionate and driven for the work, and he was so patient with me as an early careerist, working in healthcare management and in project management. And still, we met last December, and we were able to soft launch the clinic in March, and we had our grand opening in July, and which actually the American Hospital Association just did an article about them, about our clinic too. So it's just been a whirlwind, and I'm just so grateful that even though I was just a fellow, senior leadership saw what an amazing opportunity that was for me, and my skills grew so much. I got to impact real patients in a real way, and definitely one of my favorite projects I got to work on. And so that's kind of what happens in first year, and then second year we actually get to um, choose kind of choose a focus area and work more on some of our own projects. So I'm working on a project right now surrounding sustainability. Um, some things are still yet to come to fruition, so I won't say too much because I don't want to divulge too much. But it's been great just to learn the impact of um, or how we can decrease the impact that healthcare has on our environment. I One thing I want to be so considerate of as we deliver healthcare that we're not making the population sicker by our environmental impact. I think there's a lot of literature out there that would state like climate change is one of the biggest impacts to public health, to population health, and so as we really are oriented in keeping people healthy and trying to increase the health of our population, we want to make sure we do that in a sustainable and safe way.
Absolutely, that's a very important area, and it's also a very cool project working with Parkinson's disease. I've worked in the movement clinic. My family has a long history of Parkinson's disease, and so I think we talked about that earlier as well before the show last time we'd met. And yeah, very cool project. And then also on the sustainability end of things, one of the things a lot of people ask about is the ROI on these things, but also the community impact. Um, have you seen situations in studies or examples where it's possible for a hospital to actually harm their community, like you had said, by through pollution or things? Have you seen that occur before?
Personally, I have not seen that, but I think, and I'll have to fact check this statistic, but if we look at the impact of overall healthcare in the United States, I think the statistic is if the United States was its or if the United States healthcare system was its own country, it would rank seventh in the world for highest carbon footprint.
Mm.
Um, and so definitely not a small impact. And so I would say individually, I don't know of any hospitals that are doing direct patient harm, and I would hope that's not occurring. But due to sustainability, or due to carbon emissions, but I would say overall, we know the impact of carbon emissions and what they have on our climate health and on population health. So I don't know of anything specifically.
But collectively is where you're saying that's
Yes,
where the
yes,
concern is.
exactly. Yes, and then I think, anytime there's a movement, right, even if it's a collective movement, it starts really with the individual. So, there's a lot of initiatives that are national collaboratives surrounding sustainability in healthcare. So the Joint Commission just put out their sustainability in healthcare certificate. Um, or their sustainable healthcare certificate. And that really pinpoints 6 different areas that an organization can focus on to decrease their carbon footprint and decrease their greenhouse gas emissions. And so I think there's a lot of collaborative ways that organizations can focus on decreasing their carbon footprint. And as more and more organizations are engaged with sustainability efforts, the hope is that we'll reach net neutrality on carbon emissions.
And so you must be kind of working on the bleeding edge of this, right? Because healthcare is slow when it comes to adopting new technologies or sustainable initiatives. So you guys must be really right at the edge of what's happening.
Yeah, it's really exciting. I think more when I was interviewing for fellowships 2 years ago, I asked a lot about sustainable healthcare as a part of the interview process, and a lot of people told me that's what made me stand out as a candidate. They're like, no one asked about sustainability, and no, we weren't really doing anything. And just seeing where we're currently, as you alluded to, in our rounds of fellowship interviews at the moment, and when I would say we interviewed a decent amount of candidates, like close to 23. or 23 exactly. And I would say 6 people I can just think of at the top of my head asked about
Oh, wow.
sustainability. Like, what are you guys doing about sustainability? A lot of health MHA programs are now offering sustainability certificates. So there's a lot of movement there, and even just 2 years, it's been exciting to see culturally what's changing in the healthcare space, but also very exciting for me. I think I'm at a great position where getting involved in these initiatives early has been great for me. So um, I've really enjoyed it, and I think it's been a great opportunity to really level set myself to be ahead of a lot of organizations and maybe ahead of a lot of individuals in the sustainability.
No, that is great. Yeah, that is so funny how you were like one of the only people at the beginning, and then now a couple years later, right? It's becoming more and more common, and that's awesome. And then, so last question for you is: you're just coming back from kind of one of these conference, or learning educational sessions with Disney, right?
Yes.
You have to tell us about that. It seems to be very unique, and you were actually like one of the first times I've heard about this. So please, if you don't mind, just sharing it.
Yeah, I'll just put a plug into how amazing the fellowship is, that we have 2 conferences sponsored during our time as a fellow. So one during our first year and one during our second year. And fellows have complete autonomy on where they can go. For the most part, within reason. The Disney Leadership Institute or Disney Institute leadership training is the price of 2 conferences. And so
Wow.
I asked Wendy, as my mentor, I was like, hey, this is something I'm very interested in. Would it be possible to donate some flexibility to me? And if I just went to one conference, but had this, intense, it's a week-long conference as well. So that's a little unique too. Most conferences are just a couple days, but week-long conference, 4 days, I guess, 4 intensive days in training, and it goes over how Disney has maintained Walt Disney's legacy. It's a 100-year-old vision, or sorry, 100-year-old organization that has really clung to its legacy and its values, and how we as leaders can apply those same principles to be better leaders within our organizations. And so it was overall just such a fabulous experience. But some of the things that I really loved was they have an acronym there, and it's FAIL, and FAIL is short for First Attempt in Learning. And one of our mentors here, our chief operating officer, is our mentor, one of the mentors within our program. Min Lee, I love to give her a shout out. She always encourages us to fail forward. And so it really validated for me that a lot of the experiences I'm getting as a fellow translate across industry. And so as we fail forward, or as we have that grace to say, hey, I'm going to do something really scary, or there's going to be a big risk here. Um, but hey, it's just my first attempt in learning. So I really loved that. I loved how there was conversation around how, as leaders, even though it's difficult and it's a skill, we're there to invite the uncomfortable spaces. So a lot of times, we talked about growth and how, sometimes healthcare is a slow adopter of things. But as leaders in healthcare, wanting to drive change, wanting to enhance adoption of improvement initiatives, we need to invite those uncomfortable spaces. So really enjoyed learning that and loved that. Just so much to learn and talk about. But I think overall, the biggest thing that I took away from that conference is anchoring to your values.
Yep.
And so I think people who are familiar with Dare to Lead are familiar with this concept of having of values, that's how you show up every day, and how that's how you make decisions of, is this being true to my values? And I really found that Disney leadership training was very similar to um, having values that you are committed to, and how you use those values to make goals or have a vision for yourself or vision for your team. And so that's one thing I think about when things happen now. It's just been a little over a week and a half, but things happen, and I reflect, and I'm like, okay, like, how should I approach this? What are my values? And so, and I'll just answer that my values are trust and empathy. And so which in some ways can be contradictory of one another, but I'm going to trust that my team is doing a great job. I'm going to be empathetic when someone doesn't level up to expectations, or be empathetic of different circumstances, situations. So um, it's just been so reflective and so beneficial to think about what my values are, and really have that moment to anchor to my values and then react to situations.
That is so awesome. Thank you for sharing that with us because it's such a unique experience. I'm sure a lot of people have seen that before out on the LinkedIn and whatnot, and they've wondered about it. So thanks for sharing with that. And that is so awesome that your fellowship program is so flexible.
I can't say enough amazing things about just the mentorship of the program, the quality of projects that they entrust us with, and overall, just yeah, like how, the flexibility, and how, I really truly feel like this fellowship is made for the individual. And even though it's, one of 500 fellowships in the country, and maybe I exaggerated that number, but it's one of, hundreds of fellowships. It really is at the same time so specific, while also offering those same opportunities that many you can find at many fellowships.
Well, thank you so much for coming on, Hannah. I hope that we can have you back on as you ascend to your chief sustainability officer role in the coming years. So, thank you so much for coming on, and I really do appreciate your time.
Thank you. From your lips to God's ears. Thank you.
Oh, that's a good one. Nice. Okay.